If your hands or feet ever feel thick, clumsy, or strangely disconnected, almost like they're wrapped in invisible gloves, I want you to pause for a moment and really listen. Because that sensation is not just aging, and it's definitely not something you should brush off. I'm Dr. Christina Serrati. And for over 2 decades, I've worked with patients who were told their nerve damage was permanent, irreversible, something they'd just have to live with. And I can tell you right now, that statement is far too often wrong. Let me tell you about a patient I'll call Patricia. Patricia was 69 years old when she came to my clinic. 6 months earlier, she started noticing something unsettling. While cooking dinner, her fingers would suddenly go numb. A mug would slip out of her hand without warning. At first, she laughed it off. But then it escalated. One morning, she couldn't tell whether her bathwater was warm or scalding. Twice, she burned herself badly. At night, she'd wake up with an intense pins and needles sensation in her feet, so severe it felt like electrical shocks shooting through her legs. Some nights, the numbness was so complete she felt as if her feet didn't belong to her body at all. That fear is something I see constantly in my practice. Patricia did what most people are told to do. She went to her doctor. After referrals, expensive nerve tests, and long appointments, she was given a diagnosis that crushed her spirit: peripheral neuropathy. The message she received was blunt and final: the nerve damage is permanent. We can't fix it. We can only manage the symptoms. She was handed a prescription and sent home. Within 2 weeks, Patricia felt worse, not better. She was dizzy. Her balance was off. She fell getting out of bed. Her daughter became terrified that one more fall could mean a broken hip. And despite the medication, the numbness and tingling never improved, not even slightly. That's when Patricia's daughter brought her to see me, and what I discovered made me angry, because it happens every single day. And it doesn't have to. Patricia had been told her nerves were beyond repair without anyone checking for one of the most common, most overlooked causes of nerve malfunction. No advanced scan. No expensive procedure. Just a simple, affordable blood test that was never ordered. Here's the truth most people aren't told: in many cases, neuropathy isn't caused by permanent nerve death. It's caused by something far more basic, and far more fixable, and once that missing piece is addressed, nerves can begin responding far faster than most people imagine. In Patricia's case, the change didn't take months. It didn't take years. It took days, and what helped her wasn't a new drug, a risky procedure, or an experimental therapy. It was something you can find at nearly any pharmacy. Before I explain why this works, and who it works best for, you need to understand what peripheral neuropathy actually is, and why the standard explanation you're given is incomplete, because once you understand that, everything changes. To understand how nerve sensation can return, we first need to clear up a major misunderstanding about peripheral neuropathy. The term sounds frightening, and it's often explained that way, but it simply means this: the nerves outside your brain and spinal cord are not communicating properly. These peripheral nerves act like electrical cables. They carry messages from your brain down to your hands, feet, arms, and legs, and then send sensory information back up. Temperature, pressure, pain, balance, grip strength, coordination. When these signals weaken or become distorted, you experience numbness, tingling, burning, weakness, or that strange, cotton-wrapped sensation so many patients describe to me. Now here's what most people are told: they're told the nerve fibers are dead. They're told the protective coating around the nerves, called the myelin sheath, has deteriorated beyond repair. They're told nothing can be done except suppress symptoms with medication. That explanation sounds scientific. It sounds final. But it skips a critical question: why did the nerve stop functioning in the first place? In my experience, most cases of so-called idiopathic neuropathy, meaning neuropathy with no clear cause, are not caused by irreversible nerve death. They're caused by a lack of essential nutrients the nerves require to function, protect themselves, and regenerate. Think of your nerves like insulated electrical wires inside your walls. If the copper inside the wire is damaged, if the insulation is cracked or thinning, if the system lacks the materials needed for repair, the electricity won't flow properly. That doesn't mean the wire is permanently useless. It means the wire is malnourished. Your nervous system depends heavily on specific nutrients to maintain signal strength, protect nerve fibers, and repair microscopic damage that happens every day. When those nutrients are missing, even slightly, nerve signals weaken over time. This doesn't happen overnight. That's why neuropathy often sneaks up gradually. First, mild tingling, then numbness, then balance issues, then loss of temperature sensation. By the time most patients seek help, the problem has been building quietly for years. Here's what shocked Patricia when I reviewed her medical history: she had undergone nerve conduction studies. She had EMG testing. She had specialist consultations. But no one had checked the nutritional foundation of her nervous system. No one had tested whether her body actually had the raw materials needed to keep nerves alive and responsive. Instead, her care focused entirely on managing discomfort, without addressing the reason the discomfort existed, and that's where modern medicine often goes wrong. Suppressing symptoms does not equal healing. Numbing nerve signals does not restore nerve health. If you never identify what the nerve tissue is missing, the underlying problem continues, even if the pain is temporarily dulled. In the next part, I'm going to explain the 3 specific nutrients your nerves depend on more than any others, and why lacking even one of them can quietly sabotage nerve function, because once these are restored, the nervous system often responds far faster than people expect. When it comes to nerve health, there are 3 nutrients your body depends on more than almost anything else. Without them, nerve signals weaken, insulation breaks down, and repair processes slow to a crawl. These are not obscure compounds. They are not experimental treatments. They are 3 specific B vitamins, and your nervous system cannot function properly without them. Let me explain this in a simple way. Your nerves work like a living electrical system. For that system to function, 3 things must be in place: signal transmission, protection, and repair. Each of these depends on a different nutrient. The first is vitamin B1. Also known as thiamine. B1 plays a critical role in how nerves generate and transmit electrical signals. Without adequate B1, nerve impulses become weak and inconsistent. Patients often describe this as numbness, heaviness, or delayed sensation. It's not that the nerve is gone, it's that the signal is underpowered. I often tell patients to think of B1 as the internal wiring that allows electricity to flow. When levels drop too low, communication breaks down. The second nutrient is vitamin B6. B6 is essential for maintaining the myelin sheath, the protective coating that surrounds nerve fibers. This sheath works like insulation around an electrical wire. When it's intact, signals move smoothly and efficiently. When it deteriorates, signals leak, distort, or fail altogether. Low B6 levels are commonly associated with tingling, burning sensations, and poor coordination. Without proper insulation, nerves become hypersensitive in some areas and numb in others. The third, and most critical, nutrient is vitamin B12. B12 is directly involved in nerve regeneration and repair. It supports the process your body uses to rebuild damaged nerve tissue. When B12 levels fall too low, the nervous system loses its ability to recover from even minor daily wear and tear. Over time, that damage accumulates. This is why B12 deficiency is so strongly linked to numbness, balance problems, memory issues, and loss of sensation, especially in the hands and feet. Here's the part that most people don't realize: these 3 nutrients don't work in isolation. They work together. You can't properly rebuild nerve tissue without B12. You can't protect nerve fibers without B6. And you can't transmit signals efficiently without B1. When even one of these is low, the entire system suffers, and yet, many patients with neuropathy are never tested for these deficiencies. They're told their nerves are permanently damaged, without anyone asking whether the body simply lacks the materials required for nerve function. In Patricia's case, when I finally ordered comprehensive blood work, the answer became painfully clear. She wasn't dealing with mysterious nerve death. She was dealing with multiple, untreated nutrient deficiencies, and once those deficiencies were corrected, her nervous system did exactly what it's designed to do. It responded. In the next part, I'll walk you through why these deficiencies happen so often, especially as we age, and how common medications quietly drain these nutrients without warning. One of the most frustrating things about peripheral neuropathy is that it often feels like it comes out of nowhere. Patients tell me, "I didn't change anything," or "I eat reasonably well," or "this just showed up with age." But when we dig deeper, the cause usually isn't mysterious at all. In fact, B vitamin deficiencies are incredibly common, especially in adults over 50, and most people have no idea they're deficient until nerve symptoms appear. Let's start with the most obvious factor: absorption declines with age. As we get older, the stomach produces less acid. That acid isn't just for digestion, it's essential for absorbing certain nutrients, particularly vitamin B12. Even if you're eating foods that contain B vitamins, your body may not be absorbing enough to meet nerve tissue demands. That alone puts millions of seniors at risk. But there's another factor that plays an even bigger role, and it's one doctors rarely talk about: medications. Many of the most commonly prescribed drugs quietly deplete B vitamins over time. Patients take them faithfully, trusting they're helping, without realizing they're slowly draining the very nutrients their nerves depend on. One of the biggest offenders is acid-reducing medication. Drugs taken for heartburn or reflux dramatically reduce stomach acid. That makes B12 absorption extremely difficult. I've seen patients on these medications for years without a single B12 level ever being checked. Another common culprit is diabetes medication, particularly those taken long-term. These drugs are well known to interfere with B12 absorption, yet many patients are never warned. Diuretics, often prescribed for blood pressure or swelling, can lower B1 and B6 levels over time. Even everyday medications like aspirin, when used regularly, can contribute to gradual depletion. Patricia had been taking an acid-reducing medication daily for nearly 8 years. 8 years of silent depletion. No one warned her. No one tested her levels. No one connected the dots between her medication and her worsening nerve symptoms. So when her numbness appeared, the assumption was that something irreversible had happened, when in reality, her nervous system had simply been starved of essential nutrients for years. This is why neuropathy so often progresses slowly. It's not sudden nerve death. It's gradual nutritional depletion. By the time symptoms become obvious, the deficiency has already been present for a long time, and here's the most important part: when the deficiency is corrected, the nervous system often responds quickly. Your body wants to heal. It's constantly repairing tissues, when it has the materials to do so. In the next part, I'm going to explain what Patricia's blood work revealed, and why correcting these deficiencies led to noticeable changes in just days, not months. When Patricia sat across from me in my office, she was exhausted, not just physically, but emotionally. She had already been told there was no solution. That message alone can drain hope from a person. So instead of rushing to another prescription, I did something very simple. I ordered blood work, not exotic tests, not experimental panels, just basic measurements of the nutrients her nervous system depends on. When the results came back, they told a story her previous evaluations had completely missed. Patricia's vitamin B1 level was far below optimal. Her vitamin B6 level was also low, and her vitamin B12 level was hovering at the very bottom of what labs label normal, a range that does not reflect what nerve tissue actually needs to function. This is a crucial point most people don't understand. Lab reference ranges are based on population averages, not on what's optimal for nerve repair. Many patients are told their levels are fine even when they are nowhere near sufficient to support nerve regeneration. Patricia's nervous system had been running on empty for months, possibly years. Her nerves lacked the raw materials needed to transmit signals, maintain insulation, and repair daily microdamage. That's why her symptoms progressed. Not because her nerves were dead, but because they were deprived. And here's what upset her the most. No one had checked this before declaring her condition permanent. Instead of identifying the root cause, she was given medication designed to mute nerve signals in the brain, not restore nerve health. That approach doesn't heal nerves, it simply turns down the volume. Once we saw the blood work, the plan became clear. The goal wasn't to mask symptoms. The goal was to rebuild the nervous system from the inside out. I explained to Patricia that correcting these deficiencies wouldn't happen overnight, but that nerves often respond faster than people expect once they're properly nourished. We discussed expectations. We discussed consistency. And we discussed something very important: form matters. Not all supplements are absorbed equally. Not all forms reach nerve tissue effectively. Many people take B vitamins and see no benefit simply because they're using versions their bodies can't utilize well. So instead of guessing, we used the forms that research and experience support most strongly for nerve health. In the next part, I'm going to explain why the form of these vitamins matters so much, and how using the wrong version can make it seem like vitamins don't work when the problem is actually absorption. This distinction is critical, and it's where most people go wrong. One of the first things Patricia asked me was a question I hear all the time: Dr. Serrati, I've taken B vitamins before. If they're so important, why didn't they help? And that's an excellent question, because not all B vitamins are created equal. The form of a vitamin determines whether your body can actually use it. Many over-the-counter supplements contain versions that look good on a label but are poorly absorbed, especially in older adults. Let's break this down clearly. For vitamin B1, most basic supplements use standard thiamine. While it can be helpful, it doesn't always penetrate nerve tissue efficiently. There are more bioavailable forms that are better at crossing into nerve cells, where the repair work actually happens. If B1 doesn't reach the nerve, it can't support signal transmission. For vitamin B6, this distinction is even more important. The inactive form must be converted by the liver before the body can use it. Many people, especially seniors or those with liver stress, don't convert it well. When that happens, the vitamin passes through the body without delivering real benefit. The active form of B6 is ready for immediate use. It supports myelin maintenance directly, without relying on conversion processes that may be impaired. And then there's vitamin B12. The most misunderstood of all, the cheapest and most common form used in supplements is a synthetic version that requires multiple conversion steps before it becomes usable. Many people simply can't perform that conversion efficiently, especially those with digestive issues, genetic differences, or long-term medication use. The result? They take B12 for years and still remain functionally deficient. For nerve repair, the form of B12 that matters most is the one your nervous system recognizes and uses directly. This form participates in rebuilding nerve fibers and restoring signal strength. Without delay, when Patricia switched to the correct forms and the correct amounts, everything changed, but there's another mistake people make: dosage low. Maintenance level doses may prevent deficiency in healthy individuals, but they are often insufficient to correct an existing problem. Repair requires more than maintenance. It requires rebuilding. This doesn't mean reckless supplementation. It means therapeutic dosing, guided by research and clinical experience. Once Patricia started the right combination, in the right forms, at appropriate levels, her body finally had what it needed to begin healing. And here's the part that surprises most people: the nervous system doesn't wait weeks to respond when the right nutrients arrive. It begins adjusting almost immediately. In the next part, I'll walk you through what happened during Patricia's first 5 days, and why those early changes are such a powerful sign that nerve tissue is waking up, not deteriorating. When people hear the words nerve repair, they assume improvement must take months or even years. But that assumption comes from a misunderstanding of how the nervous system actually works. When nerve tissue has been deprived, not destroyed, the response to proper nourishment can begin quickly. I explained this to Patricia before she started her protocol so she wouldn't expect miracles overnight, but I also told her to pay close attention to subtle changes. Here's what happened. Day 1. She noticed nothing. And that's exactly what I expected. The body doesn't rebuild tissue instantly. First, it absorbs nutrients. Then it distributes them. Then it begins repair processes at a cellular level. That work is invisible at first. Day 2, Patricia said something interesting. She wasn't sure if it was real, but the tingling in one foot seemed slightly less intense at bedtime. I told her not to overanalyze it. Early changes are often inconsistent, but I took note. Day 3. She called my office. Her voice was shaky, not from fear, but from disbelief. For the first time in months, the constant electrical sensation in her feet had eased. It wasn't gone, but it was quieter, less aggressive, less consuming. That alone told me her nervous system was responding. By day 5, something remarkable happened. Patricia was running water for a bath when she suddenly froze. She could feel the difference between warm and hot water again, clearly. 5 days earlier, she couldn't. That ability doesn't return unless nerve signals are being restored. Temperature sensation is one of the first functions lost when nerves are compromised, and one of the first to return when nerve conduction improves. Over the following days, other subtle improvements followed. Her feet felt more present when she walked. She wasn't dragging them without realizing it. At night, the stabbing sensations that used to wake her from sleep became far less intense. None of this required medication to numb her brain. It required giving her nerves what they had been missing. By the end of the second week, her grip strength had improved. She noticed she wasn't dropping objects as often. Buttons felt easier. Coordination improved. These aren't dramatic, cinematic recoveries, but they are biologically meaningful signs of healing. And when we repeated objective testing later, those subjective improvements were backed by measurable changes. In the next part, I'll explain what happened after the first month, why nerve improvement continued, and who is most likely to benefit from this approach, and who needs a different strategy, because honesty matters in medicine. By the end of the first month, Patricia was no longer cautiously hopeful. She was confident something real was happening. At her follow-up visit, the difference in her demeanor was striking. She walked more steadily. She used her hands naturally while talking, something she hadn't done before because she didn't trust her grip. But I don't rely on impressions alone. So we repeated objective testing. The results confirmed what her body was already telling her. Her nerve signaling had improved significantly. Sensory response was stronger. Coordination was better. The nerves that had been labeled irreversibly damaged were functioning again, because they had never been dead to begin with. This is an important distinction. Nerves that are destroyed cannot regenerate easily. Nerves that are malnourished can recover, and this is where I need to be honest and clear, because not every case of neuropathy is identical. This approach works best for people whose neuropathy developed gradually, without a clear traumatic cause. Those told their condition is idiopathic, age-related, or unexplained are often the strongest candidates. It can also help individuals whose nerve symptoms developed alongside long-term medication use, digestive issues, or chronic fatigue. However, Neuropathy caused by uncontrolled blood sugar must be addressed at its source. Nutrients help, but stabilizing glucose is essential. Neuropathy from chemotherapy or physical nerve injury follows a different mechanism. B vitamins may still support recovery, but expectations must be realistic. What matters most is identifying the root cause. Not accepting a blanket diagnosis. Patricia wasn't lucky. She was properly evaluated, and once the cause was addressed, her nervous system did what it was designed to do. In the final part, I'm going to explain exactly what steps you should take, how to advocate for proper testing, and why you should never accept nothing can be done without asking deeper questions. If you're listening to this and recognizing yourself, or someone you love, in Patricia's story, I want you to hear this clearly. Being told nothing can be done does not mean nothing should be done. It means the investigation stopped too early. Peripheral neuropathy should never be considered permanent until nutritional causes have been ruled out. That's not alternative thinking, it's basic physiology. Your nervous system is one of the most nutrient-dependent systems in your body. When it's deprived of essential building blocks for years, function declines. When those building blocks are restored, function can return, often faster than people expect. So here's what I recommend. First, advocate for proper testing. Ask your physician for blood work that includes vitamin B1, B6, and B12. Don't accept vague reassurances. Ask for the actual numbers. Knowledge matters. Second, if supplementation is appropriate, understand that form and consistency matter. The nervous system responds to nutrients it can actually use. Random, low-dose supplements taken inconsistently often lead people to believe vitamins don't work, when in reality, the body was never given a fair chance to respond. Third, give your body time, but not blind patience. Early changes such as reduced tingling, improved temperature sensation, or better coordination are meaningful signs. They indicate nerve signaling is strengthening. Fourth, never stop looking for root causes. Medication side effects, digestive issues, absorption problems, and long-term nutrient depletion all deserve attention. Patricia didn't regain her life because of a miracle. She regained it because someone finally asked the right questions. Today, she cooks without fear of dropping hot pans. She bathes safely. She sleeps through the night. She holds her grandchildren's hands and actually feels them, and the most painful part of her journey wasn't the symptoms, it was being told improvement was impossible when it wasn't. If you take one thing away from this, let it be this: your nerves are not broken beyond repair simply because someone said so. Sometimes, they're just waiting for what they've been missing. Before you go, save this information. Share it with someone who's struggling with numbness or tingling. And remember, hope backed by knowledge is not false hope. It's responsible medicine.